Good morning. I'd like to call this roundtable to order. Today is Thursday, November 7th, 2024. The time is 9:33 a.m. We are in room 500 of the John A. Wilson Building, and this is a roundtable in the hybrid format with witnesses testifying both in person and virtually. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today, we will hear from 6 nominees to several health professional licensing boards. These boards are integral to our healthcare system in the district as they determine the licensing requirements, investigate disciplinary actions, and advise DC Health on the scope of their licensing professions. The Board of Pharmacy regulates the practice of pharmacy and the practice of pharmaceutical detailing in the district. The board evaluates applicants' qualifications, recommends standards and procedures, issues licenses, and reviews complaints. The board also administers the examination for a range of laboratory professionals who prepare, study, and process patient tissue and cell specimens. PR 25-999 nominates Dr. Jamila Jordan for an appointment as a pharmacist licensed in the district. As a pharmacist licensed in the district member of the Board of Pharmacy. Dr. Jordan serves as the Director of Experiential Programs at Howard University College of Pharmacy, where she oversees the practical experience component of the pharmacy curriculum. Dr. Jordan is also an active member of several professional organizations, including the Washington, D.C. Pharmacy Association, the Washington Metropolitan Society of Health System Pharmacists, and the Academy of Managed Care Pharmacy. Dr. Jordan holds a Doctor of Pharmacy degree from Howard University, and she's a Ward 5 resident. We have some nominees, a nominee from the Board of Nursing, which regulates the practice of advanced practical registered nursing, practical nursing, nursing assistive personnel, nursing home administration, assisted living administration, and home health care administration here in the district. PR 25-1000 nominates Ronald Bailey, sorry if I pronounced that incorrectly, for appointment as the nursing home administrator to the Board of Nursing for a term to end July 21st, 2027. Mr. Ronald Chaley is the administrator of Inspire Rehabilitation and Health Center in Washington, D.C., where he provides oversight of a 180-bed skilled nursing facility. He brings over 20 years of nursing home administrator experience in Maryland and D.C., and holds active administrator licenses in 15 other states. He holds a Master's of Business Administration from Suffolk University and is a Ward 2 resident. We have 3 nominees to the Board of Medicine, which regulates the practice of physicians, physician assistants, anesthesiologist assistants, surgical assistants, physicians in training, trauma technologists, doulas, and certified professional midwives. The board also currently oversees the practice of anesthesiologists, naturopathic physicians, although these professions will move under a new board of integrative healthcare within the next year. PR 25-1001, can't believe we got up to this far, nominates Anasia Phillips for appointment as the consumer member of the Board of Medicine for a term to end August 3rd, 2025. Ms. Phillips currently serves as a legal assistant with Ice Miller LLP. She brings prior experience from her role as an administrative assistant to the State of Tennessee Medical Board, where she reviewed health professional applications. Ms. Phillips holds a bachelor's degree in psychology and criminal justice from Wayona State University, and she's a Ward 8 resident. PR 25-1002 nominates Dr. Bernard Aarons, as a licensed physician member of the Board of Medicine for a term to end August 3rd, 2025. Dr. Aarons is a psychiatrist and behavioral health expert who has contributed significantly to mental health policy and services across various federal and local positions. He's currently the Behavioral Health Medical Director for AmeriGroup DC. Previously, Dr. Aarons was the Director of Medical Affairs for St. Elizabeth's Hospital. Dr. Aarons has also served as an advisor to the Second Lady Tipper Gore on mental health issues and led initiatives at SAMHSA to advance mental health awareness and suicide prevention. He's a Ward 3 resident. PR 25-1003 nominates Dr. Conrad Dawson for reappointment as a physician licensed member of the board for a term to end August 3rd, 2027. Dr. Dawson is the president and CEO of the Washington Area Plastic Surgery Associates with over 15 years of experience in private practice as a plastic surgeon. He's a member of the American Society of Plastic Surgeons and the Northeastern Society of Plastic Surgeons and is a fellow of the American College of Surgeons. Dr. Dawson also dedicates time to providing cleft lip and palate repairs for underprivileged children abroad. He is a Ward 4 resident. Our final board is the Board of Professional Counseling. PR 25-1037 nominates Laura Golajic. Okay. Sorry, Laura, if I'm pronouncing that incorrectly. To the Board of Professional Counseling as a licensed marriage and family therapist for a term to end July 1st, 2027. Miss Laura, can you just come off mute and tell me how to pronounce your last name? I don't want to keep saying it incorrectly.
Golajic.
Golajic. Golajic, okay. All right. Ms. Golajic practiced couples and family therapy at the Counseling and Consulting on the Hill. Ms. Golajic is a clinical supervisor and provides supervision to therapists in training and works towards licensure, as well as being an adjunct professor at University of Maryland. Dr. Golajic received her PhD in family science from the University of Maryland and is an American Association for Marriage and Family Therapy Clinical Fellow, as well as an approved supervisor. She is a Ward 1 resident. I want to thank you all for being here. We are going to start. We have 4 nominees in person, Dr. Jamila Jordan, Rano Chaley, Aneza Phillips, and Dr. Bernard Aarons. And if you guys want to come to the table. And then we'll get to our virtual folks right after this. Okay, before you begin, I have to swear you in under oath. So if all of you can raise your right hand. Do you swear and affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? Great. All right, Dr. Jordan, when you're ready. You just have to hit the button on the mic in front of you. Yep.
Thank you so much. Good morning, all, and good morning, Chairperson Henderson and members of the committee. I am Dr. Jamila J. Jordan, and it's my pleasure to receive your consideration for my nomination to serve on the Board of Pharmacy. I am grateful to Mayor Muriel E. Bowser for nominating me and honored to have this opportunity to serve the residents of our district. My journey in my life is deeply rooted in both my personal and professional connection to the district. I grew up in South Jersey, but maintained strong ties to the district through my mother's Panamanian roots. Her family immigrated to the district when she was a child, and my decision to attend Howard University. Currently, I serve as the Director of Experiential Education and as an assistant professor at the Howard University College of Pharmacy. My career speaks to my passion for the pharmacy profession and my dedication to shaping the next generation of future pharmacists. It is deeply fulfilling to be in a position where you can influence the future of the profession while contributing to my community in the district. I'm deeply passionate about supporting my local community. In addition to my professional pursuits, I actively engage in community service and outreach within the greater Washington, D.C. area. Whether organizing volunteer events, collaborating with local organizations, or contributing to charitable initiatives, I am dedicated to making a tangible difference. As a pharmacist and a dedicated citizen of the District of Columbia, I believe I would be an ideal candidate for the Board of Pharmacy. According to the board's mission, its responsibilities include recommending standards and procedures, issuing licenses, reviewing complaints, advising the mayor, and enforcing pharmacy law. With over 20 years of experience in various pharmacy practice settings, I am confident in my ability to contribute meaningfully to those goals and help further the board's important work. Beyond my experience, I have a deep passion for serving the pharmacy profession. In my current role, I develop guidelines and requirements for pharmacy students completing their experiential education. I also address any issues that arise, whether within the College of Pharmacy didactic setting or during the student's clinical rotation. This experience has strengthened my skills in problem solving, policy development, and maintaining high professional standards. Skills that I am eager to bring to the board. If confirmed, I will be able to ensure that pharmacy practice continues to evolve to meet the high standards of care. This opportunity will allow me to advocate for progressive initiatives and policies that safeguard the well-being of our constituents while promoting innovation and excellence in pharmacy practice. If confirmed as a board member, I will focus on initiatives aimed at improving the health of underserved communities in the District of Columbia. We are aware of the health statistics in wards 7 and 8 communities, and pharmacists, as one of the most accessible healthcare professionals, have an opportunity to make significant impact in the lives of their residents. Furthermore, I would like to address the process of obtaining pharmacist and pharmacy intern license in the district. While the transition to an online application process has greatly improved accessibility, no system is without its challenges and areas that require change. The first pharmacy in the United States opened nearly 300 years ago in Philadelphia, PA, not too far from the district. Over that time, the world of pharmacy has changed significantly. I look forward to driving continued change for the profession, the people of the district, and everyone that we encounter as pharmacists. Thank you, Chairperson Henderson, for the opportunity to testify before the committee, and I would be happy to respond to any questions that you and the committee may have.
Thank you. Mr. Tralee.
By the way, good job with my last name. You pretty much nailed it. Yeah. It's a tricky one sometimes. Good morning, Chairperson Henderson and members of the committee. I am Ronald Celli, and it is my pleasure to receive your consideration for my nomination to serve on the Board of Nursing. I am grateful to Mayor Muriel E. Bowser for nominating me and honored to have this opportunity to serve the residents of our district. I grew up in Marshfield, Massachusetts, to two parents who were both entrepreneurs, one focusing on insurance and the other focusing on nursing homes. From an early age, I discovered my passion for working with the elderly, as many of my close family members were seniors. I worked in the kitchen of some of my mother's nursing homes and did odd jobs such as painting, cleaning up yards, and performing resident activities. When deciding on a college major, it was easy for me to choose operations management, as I knew from an early age I wanted to be in a leadership position in healthcare. After college, despite advice to gain work experience first, I pursued my MBA immediately, believing that if I didn't do it then, I might never go back. I worked full-time in my family's company while pursuing my MBA part-time. Around the time I completed my MBA, my parents asked if I wanted to take over the family business as they prepared for retirement. I decided I wanted to work with a higher acuity population, so I suggested they sell the company and enjoy the retirement while I pursued a career as a nursing home administrator. I completed my administrator and training program in Massachusetts in 2010 and moved to Georgia, where more opportunities were more plentiful and licensure reciprocity was easier. During my time living in Georgia, I visited a friend of mine in the DC area and fell in love with the city. Upon a trip back from a long weekend in 2012, I knew DC is where I wanted to be. So I applied for my Virginia, Maryland, and DC nursing home administrator licenses. Once licensed in 2012, I was fortunate enough to get a job with Britton Woods at DuPont Circle as their administrator. The facility had its challenges and at the time was a one-star facility. However, within 2 years, we improved to a 5-star rating, which we maintained throughout my tenure. Following a change in ownership in 2016, I decided I wanted to transition to a larger company and join Saba Senior Care as an administrator at their Bethesda location. I ran a large facility for 2 years and was promoted into a regional position after that. After Saba dissolved, I took on traveling administrator roles to explore different areas of the country. It's a very small world. The current operator of Inspire Rehabilitation reached out to me to see if I wanted to return to my old facility where I'm currently employed. I'm working with my team to regain our 5-star rating, and I really enjoy being back in my old position in my favorite city in the world. I believe my experience as an operator makes me an ideal candidate for a position on the Board of Nursing, especially since the board now oversees nursing home administrators, a role I've held for 14 years. I understand the challenges and opportunities in the industry and bring valuable insights from my profession. Having worked closely with both nurses and CNAs my entire life, I am well aware of the challenges they face as a group. Additionally, my experience operating in multiple states has given me a solid understanding of direct care staffing ratios, as well as strategies to reduce direct care overtime and improve retention. I envision my time on the board to be very productive, allowing me to advocate not only for nursing home administrators in the district, but also APRNs, RNs, LPNs, and CNAs. While I've not held a board seat before, I feel well prepared to take on this challenge. My passion for quality care has grown stronger throughout the years and will continue to drive my efforts. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and the members of the committee. Thank you.
Thank you. Ms. Phillips.
Good morning, Chairperson Henderson and members of the committee. I am Anasia Phillips, and it is my pleasure to receive your consideration for my nomination to serve on the Board of Medicine. I am grateful to Mayor Mira E. Bowser for nominating me and honored to have this opportunity to serve the residents of our district. About a year ago, I moved from Nashville, Tennessee to the district. During my time in Nashville, I worked as an administrative assistant for the Tennessee Board of Medicine, where I gained firsthand experience in the vital role these boards play in advocating for the safety of both patients and medical professionals. I managed interstate medical compact applications and served as a frontline resource for answering phone calls and assisted with setting up meetings. After observing each board meeting, I became increasingly interested in being a part of the board. Therefore, upon moving to the district, I decided that I wanted to pursue this opportunity. Working for the Tennessee Medical Board has provided me with the experience and insights that are highly relevant to serving on the district's Board of Medicine. In Tennessee, my role involved navigating complex regulatory frameworks and ensuring compliance with medical standards and addressing public concerns in healthcare practices. This background has deepened my understanding of medical governance, and which is essential for making informed decisions and impact public health and safety in the district. I am committed to serving on the board to advocate for the interests of both patients and doctors while ensuring the safety and well-being of our community. I aim to represent the new generation of patients and medical professionals by promoting policies and practices that prioritize their needs and rights. This includes ensuring access to quality care, fostering transparent communication between healthcare providers and patients, and addressing the disparities in care. Recognizing the vital role that healthcare providers play in our community, I intend to advocate for their professional development, mental health support, and fair working conditions. By ensuring that our healthcare professionals are well supported, we can enhance the overall quality of care provided to patients. I will commit to staying informed about emerging healthcare trends, policies, and best practices, empowering me to advocate effectively for necessary changes that benefit our community and enhance the overall healthcare landscape in the district. Through my involvement in the board, I am dedicated to being a voice for both patients and doctors, ensuring that our healthcare system remains safe, equitable, and responsive to the needs of all. Together, we can build a healthier future for the District of Columbia. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and the members of the committee.
Thank you. Dr. Ahrens.
Good morning, Chairperson Henderson and members of the committee. I am Dr. Bernard Ahrens, and it is my pleasure to receive your consideration for my nomination to serve on the Board of Medicine. I am grateful to Mayor Muriel E. Bowser for nominating me and honored to have this opportunity to serve the residents of our district. I have lived in the district since 1973 and have worked professionally in the field of medicine since that time. I am board certified in psychiatry as a specialty. My professional experiences and responsibilities have taken me to work in a variety of leadership and scientific advisory positions that included behavioral health, but often more broadly in medicine. I worked at St. Elizabeth's Hospital, our DC public psychiatric hospital, for 13 years when it was under the federal government management, and then later for 8 years when it was under District of Columbia management. Additionally, I have worked in a variety of other public health organizations. Currently, I work at AmeriGroup District of Columbia, one of the managed care organizations charged with oversight and direction of the Medicaid program. In my professional career, I have had the good fortune of being in a number of leadership positions in the healthcare field. I have supervised and observed the work of individuals in a variety of health professions and have been able to observe the wide range of medical practices from the outstanding to the more problematic and questionable. I have also worked with many of the facilities involved in healthcare in the district, either directly or through professional committees and task forces. My present position provides me with a perspective on all those providers and facilities serving individuals in the district who are covered by the Medicaid program. In addition to my professional employment, I served on the Board of Medicine in the past. This provides me with meaningful and relevant knowledge and experience from which to draw in working on the issues that are faced on the Board of Medicine. If I am fortunate in the successful approval of my nomination, I look forward to helping the Board of Medicine continue the outstanding work done on a continual basis to assure that individuals receiving healthcare in the district are protected from any healthcare provider who provides substandard or questionable treatment or who presents themselves in a manner that is in conflict with the standards of their profession. From my previous experience on the board and conversations with recent members, I understand that a perspective grounded in psychiatric and substance use disorders can be of great help. I will bring the wealth of my experience, skills, and professional knowledge to this work. Thank you, Chairperson Henderson, for the opportunity to testify before this committee. I would be happy to respond to questions from you and the members of the committee.
Thank you. Thank you to all of you, and thank you for your willingness to serve. These are unpaid positions, and so to give of this extra time, we need people to do it, and so we thank you for saying yes when called. I'll start with you, Dr. Ahrens. Thanks for your willingness to do this a second time, another tour of duty, if you will. Are there any lessons that you have learned from like the last time that you were on the board to this time that you want to do differently?
Oh, I think I would. I thank you for the question, and I do appreciate that my willingness to serve another term on the board is influenced by my previous experience. I found that I think that working with colleagues on the board was a very rewarding experience. I found that those who were selected to work on the board took their responsibilities seriously, and I valued that their input and the input I could give in the exchange a very important process in making decisions that were facing the board.
Okay. Is there anything you want to do differently this time around?
I found the information from the investigators who work for the board and the legal advisors were very valuable, and I hope to have increased opportunity to learn from them if I'm able to serve on the board again.
Okay. You spoke a little bit at the end of your testimony around the need right now for more expertise on substance use disorder and a variety of mental health issues. Since I have been chair of the committee, one of the things that I have been hoping to see more from our boards, as opposed to just dealing with the licensing issues, was also being a voice for some of the challenges facing the profession, of whatever board that they're representing, that we haven't really seen a lot of beyond, it's taking 3 weeks too long in order for licensing to be processed, but actual talking about some of the challenges facing the profession, especially as we have seen a number of people leave the healthcare workforce. I'm curious, what do you think are some of the opportunities to better align some of our needs with the expertise of the board?
So the Board of Medicine for a number of years, in addition to the ongoing work with individual complaints or cases, has been doing surveys of what are the issues that are facing the medical field in the District of Columbia. And one of the issues that we all face as citizens of the district is availability and access to timely response to our medical needs. At the same time, the profession is facing, as you mentioned, individuals who are leaving the profession. I believe that the board could be more active in responding to what is now commonly and frequently discussed both in the profession as well as the public press around the stress on the healthcare workers, the need to improve a professional life balance, and what we can do as a community as a whole to assure that we have adequate healthcare in the District of Columbia.
I would agree with you on that. Definitely seen that from not just for the Board of Medicine, but for all of the other boards who also engage in this sort of workforce survey. Ms. Phillips, thank you again for your service. And also, I love the fact that you applied for this opportunity based on your experience working for the Tennessee Medical Board and wanting to stay involved, if you will. Now, the role of the consumer member is to bring the perspective of the healthcare consumer, not necessarily the perspective of the healthcare professional. Can you elaborate a little bit in terms of how you want to approach that? I know you spent some time in your testimony talking about the workforce, but what about the consumer?
Yeah, definitely continue to speak with my community and talk to people who are also, patients in our community and getting their perspective, and also being open and bringing that to the board and being empathy to our community. And because I think there's, as you said, this as a consumer member is to bridge the gap between the medical professionals and the community. So just being out in my community and listening to patients and being open-minded to their questions and concerns.
Yeah, I'll be interested after a little bit of time for you to definitely share what you feel like are some of the biggest differences between the Tennessee, how the Tennessee Medical Board operates and the DC Medical Board, and perhaps there are some best practices or recommendations that we can learn from that jurisdiction. Mr. Chile, I think your resume is incredibly impressive in terms of the work that you have done. We have spent some time, the committee, in the past year working on long-term care because we see this as a growing issue, particularly in DC, where we have a lot of individuals who either want to age in place or they want to age in the city. We may not have enough beds for them to do that, nor enough direct care workforce to also support, home health aides, et cetera. And so the work that you do, I think, is incredibly important and perhaps sometimes overlooked in terms of its importance in the health and the care space. So the Board of Long-Term Care Administration was recently sunset under legislation that we did, the Health Occupation Revision. And there was definitely some concern about moving long-term care into the Board of Nursing. What do you think are some opportunities here, and how are you going to ensure that the nursing home point of view is still made on a board that now isn't necessarily fully directed at that?
Sure. So I think for us, our biggest challenge as an operator in skilled nursing facilities is staffing. And it's licensed staffing, whether it's a CNA, certified, it's a LPN RNs. It's our biggest challenge is staffing and retention. I think I can speak for my facility, we do a good job of retention. One of the things I think it's easier said than done. People talk about getting into the compact states. A lot of the nurses now are part of the compact states, and that's something I'd like to do a deep dive into with the Board of Nursing, looking into kind of that compact structure, if we can get involved in that. I can speak that, for instance, this year, nursing home administrators and RNs have to renew their licenses by the same date, which is June 30th, every even year. And it was definitely a struggle this year. There was an extension for a month about making licenses, active, so they work on a pending license for that month as long as they had renewed prior to the expiration date. I have seen, for instance, I just hired a new director of nursing, started this a few months ago. The licensure process was quite a challenge for her. Fortunately for her, she did get licensed, but we had to kind of hold off to bring her on board. So I had to use an interim in the meantime for that. So I do want to meet, with the board to discuss how we can kind of streamline the licensure process. I do want to look at staffing ratios. DC, I remember I started in DC back in 2012. And I believe that's the same year that the staffing ratios were updated to the 4.1 hours per patient day and the 0.6 hours for registered nurses. And I think we have the highest, if not one of the highest staffing ratios in the country. As an operator, we do hit those ratios. Obviously, there's financial impact to that as well. Rates keep going up and up and up. I should say wages for nurses and CNAs. So that's something I want to look into as well is, can adjustments be made from the HPPD standpoint? Would it be benefit the residents in the facilities? So those are kind of some things I really want to look into during my board time if selected. And again, it's my first time even applying for or volunteering for a board seat. I just felt at this point with my experience and having operated in multiple states, it was just time to give back and really volunteer. So better late than never, I guess.
Better late than
So,
never.
yeah, I'm not getting any younger, so I think I just feel a good time. But again, as an operator, those are kind of some of the challenges and things I really want to work with the board on.
Thank you.
Yeah.
That was such a comprehensive answer. I don't have any more questions for you because you like covered all the things. I was going to ask you, what do
I'm
you
known
think
for that.
the biggest challenge in the sector? Staffing is the biggest challenge.
It is. Staffing by far is our biggest challenge, particularly direct care. I mean, we can get, cooks, dietary aides, housekeepers, laundry pretty easily. It's the nurses, specifically RNs, that are the challenge. Again, we're competing with, acute care,
Mhm.
hospitals, home health, for instance, assisted living. We do have a new facility opening up in January, another Inspire without the E at the end, which is going to be, I believe, independent assisted living over on Embassy Row. So they're opening up January. I've already gone over there and introduced myself at their office. They open up January 15th, and
Yeah.
almost the same. It's the same name, they just dropped the E for their Inspire Embassy Row.
But they're not part of the company?
No,
Oh,
no, they're out of New York. So different
Okay.
business model. They're all private pay. We've heard some rumblings that they're trying to recruit some staff as well. In the area.
coaching.
Coaching.
Oh, man. The hard
It's all
part.
good. It's
I have seen the building on Embassy Row. So I remember thinking to myself, oh, I see the fancy, high price,
Yep.
independent living, not fancy. Well, yes, fancier.
yeah.
But I thought, oh, this is an interesting location in terms of like proximity to the embassies, but also proximity to DuPont Circle or university to be able to take advantage of all those sort of cultural amenities, if you
Yeah.
will.
Yeah, it was a Fairfax hotel, I believe, and they're doing a renovation there. It's right around the corner from us.
Yeah.
So they're actually, their sales office is next door to us. So I just popped in there a few weeks ago and
Okay.
said hi.
You just gotta keep
Introduced
eyes
myself.
on them. Just make sure you keep your staff.
Oh, yeah. Well, I'm all over it. Yeah.
Dr. Jordan, thank you for your willingness to serve. I feel like the profession of pharmacy, the scope of what pharmacists do has changed so dramatically, especially since the pandemic.
Mhm.
I even know, like, I went to get my fluster, went to the pharmacist, and they were the ones who administer it as opposed to going to primary care. How do we get more people to enter the pharmacy workforce space? Because I think one of the biggest complaints that I hear from some pharmacists is particularly those who work for corporate pharmacies as opposed to independent entities, is that they're not enough of us and they're feeling overworked. And so I guess I could ask that question about anything, whether it be physicians who have a focus in psychiatric care. I could say that for nurses who want to go into long-term care, and I could say that for pharmacists.
Yes.
Just overall, how do we turn this around where people see healthcare as a viable profession for them?
And it's definitely a question that has been asked not only at Howard University, but all colleges and university of pharmacy nationwide, because we have seen a decrease in enrollment numbers. I think what we really have to do is sometimes get out there and be our best own promoters. A lot of people don't look at pharmacy or pharmacists as a viable healthcare option. My mother is actually a nurse, and I remember for one time she said like something about just putting pills in a bottle, and I think people downgrade. Oof. I was like, oh, it's okay. But I do understand that some people don't see the magnitude or the usefulness of pharmacy. And I think we need to do a better job of promoting what we do as a profession and how we are really out there as healthcare providers, with some of the most accessible healthcare providers out there. To your point, a lot of individuals get vaccinations through their pharmacists, and also a lot of individuals are medically managed. So those medical management needs somebody who's a medicine expert.
Yeah.
While all of the healthcare professionals come together to make the person healthier and to help with their healthcare, pharmacists, our role is to be medication management experts. So it is really on us to make sure that you're using the right medications at the right dosage at the right time. So we really need to really promote our profession as a viable option for those who want to go into the healthcare profession and really touch the people and get into the community and work with individuals who are on medications that need our assistance.
Yeah. I mean, I just even sort of like the math and science behind, you can't just pop 100 pills in a bottle and
Yes.
say on your way,
Correct.
that could kill you. But there's those pieces to that. I had a meeting a couple of years ago with the dean of the medical school at Howard, and she said a lot of our programs to expose the health professions to young people are starting too late. She's like,
Oh,
if
okay.
you are doing
And
this
I-
in high school,
I would agree.
it's too late.
And I would agree. And some of it is going to be, based on availability, timing, and also obviously money and funds. But to have that pipeline program to start even in the elementary, it's maybe not pipeline, but exposing people to the idea that, yes, you could be a doctor, a lawyer, a nurse, but you can also be a pharmacist. When they ask little kids, what do you want to be? Kind of exposing them to that in maybe middle school, maybe even slightly in elementary schools, to just kind of get their idea. Because I do think some people don't think of it as a viable option just because they just don't know.
Yeah. So in terms, you recently had experience as on the Legislative and Regulatory Action Committee
Oh, yeah.
for the Academy of Managed Care Pharmacy.
Mhm.
From a legislative or regulatory standpoint, what do you think are some of the pressing issues facing the profession?
Provider status.
Provider status?
Yes.
Okay.
I think that just recently, providers status and also an effective payment model. I think recently the Board of Pharmacy, not Board of Pharmacy, DC law did pass that pharmacists are allowed to get provider status. However, the payment model has not caught up to that part of the law. So being able to actually be a viable option in the healthcare spectrum. Again, I know that physicians do a good job and they have an important job, but some of the easy to treat disease states that can be done through review of laboratory results and through medicine can be handled by pharmacists. There are some states where pharmacists can test maybe COVID, flu, and then hopefully be able to prescribe the medication as the next step to say, okay, you have this disease state, let's go ahead and prescribe it. Because again, it takes off some of the burden off the physician's urgent care, even the ER, if we're able to be another part of that healthcare spectrum.
Yeah. I was talking to someone, they said they called to get a primary care appointment and they offered them sometime, what was it?
Probably.
May of 2025.
Yeah.
And it was like, but I need it today.
And there are, and with any profession, there are shortages. So I have seen some retail community pharmacies changing their model to kind of take some of the drug distribution off of their pharmacists to let the pharmacists do more medication therapy management. And then maybe hopefully more, not, I want to say low scale, but easier testing. And then hopefully one day then prescribing a medication for those more simpler disease states, for lack of a better word.
Okay, interesting. Yeah, we had heard from pharmacists around the provider status, so we did make that change. We got to follow up on the effective payment model portion of that, which we certainly can do. And I think this is part of the work and conversation with our boards, wanting them to be more active participants on the regulatory and legislative piece, while also, yes, taking care of efficient licensing and all of those other things. I will tell you guys what I have asked for DC Health and what HRLA, and what I will continue to push for is I don't understand how I can track a pizza online, but I can't track my application for licensing online, right? The pizza, you go Domino's, they tell me when they put it in the oven. We just let it go for months. If somebody have some part of their application that's missing, we never tell them. And then they call 50 times, then, folks are upset that they're upset. And it's like, if we were just, if there's technology solutions for this, for us to be more communicative without needing to have folks have to proactively call, but just to inform people. There was one woman who was trying to get her license for nursing, and it took so long that her background check then expired, but nobody said anything. It was just, we got to do better. So as nominees, and soon to be confirmed folks, I hope that you guys will take this on. My final question for all of you is the hope that someone at DC Health or your various boards have reached out to explain to you the time commitment. And I just want to make sure from all of you, I'll go down the line and you tell me verbally that you feel like you have the capacity to attend the meetings and fulfill the duties. Ms. Phillips?
Yes, I have the ability.
Great. Dr. Aaron's?
Yes, I'm prepared to do that.
All right. Mr. Chele?
I am prepared to do it.
Awesome. And Dr. Jordan?
Yes, I'm prepared for the duties of the position.
Okay, great. I think we have all the documents and paperwork that we have for you. So thank you so much. We're going to go on to our next panel. Dr. Dawson, when you're ready.
All right, let me get this set. Good morning, Chairperson Henderson and members of the committee. I am Cameron L. Dawson, MD, and it is my pleasure to receive your consideration for my nomination to serve on the Board of Medicine. I am grateful to Mayor Muriel Lee Bowser for nominating me and honored to have this opportunity to serve the residents of our district. I have been in the practice of plastic and reconstructive surgery for over 30 years here in Washington, D.C. My journey started at Morris College, where I received a BS in biology in 1977. This was followed by obtaining an MD degree at Meharry Medical College in 1982. I subsequently did a residency in surgery at Wayne State University Medical Center in Detroit, ending in 1988. This was followed by a residency in plastic and reconstructive surgery at Georgetown University Medical Center from 1988 to 1991. After training, I decided to begin practice here in Washington, D.C., and it is where I've been since 1991. I have maintained my office at 106 Irving Street, Northwest Washington, D.C. For over 33 years, and I have privileges at multiple area hospitals. During my time in practice, I have participated in a range of activities connected to my field, ranging from mission work in the Dominican Republic and Peru, where we operated on kids with cleft lip and palate and other problems, all the way to treating patients with trauma-related injuries and cancer-related deformities. I also have the privilege of serving in several different medical positions over the years, including being chief of surgery at Prince George's Hospital Center, now at University of Maryland Capital Regional Health, as well as chief of plastic surgery at the same institution. I have served on multiple hospital committees and medical boards at MedStar Washington Hospital Center, as well as UMCRH. I have also served on the Board of Trustees of United Medical Center, as well as the Maryland Cannabis Commission. I also have the honor of serving on the DC Board of Medicine for the past 6 years. I believe that I possess the requisite experience, intellect, and work ethic to continue serving on the DC Board of Medicine. The DC Board of Medicine is charged with enhancing the health, safety, and well-being of District of Columbia residents by promoting evidence-based best practices and health regulation, high standards of quality care, and implementing policies that prevent adverse events. The board is responsible for regulating the practice of medicine in the district. During COVID, all of these policies came to bear in helping us to navigate through that once-in-a-lifetime epidemic. Moving forward, I would like to continue to work with the other members of the board in promoting best practices, patient safety, healthcare efficiencies, and physician improvement for the citizens of the District of Columbia. I look forward to your decision. Thank you, Chairperson Henderson, for the opportunity to testify before your committee. I would be happy to respond to any question from you and the members of the committee.
Thank you, Dr. Dawson. Dr. Golichuk? If you're speaking, you're on mute. Dr. Golichuk? Okay, maybe she stepped away. And so Dr. Dawson, I know that you have patients that you need to see today. So I'm going to go ahead and ask you some questions and hopefully Dr. Golichuk will join us again. Dr. Dawson, thank you so much for your willingness to serve. And I'll say the same that I shared with the other panel. In terms of the Board of Medicine, and I asked a little bit of this to Dr. Ahrens, what do you think is probably one of the biggest challenges practitioners in the district face today? And how do you think we can address those through the board?
Yeah, I think Dr. Ahrens touched on it quite a bit, but the stress level amongst the physicians in the District of Columbia probably at all times high. I think it's always been there, but it got exacerbated, or probably more importantly, exposed by the COVID pandemic. After that, we saw a lot of physicians retiring, taking early leave. It's been a real problem when you're dealing with the stress level, and that stress is compounded by a whole host of things causing it. You know, everybody has their own problems with family and friends and what have you, but the pay levels, the all of the requirements that we put on physicians, I think has really created a problem that we may have a problem in the future of getting really qualified physicians to serve in the different positions that we have here in the district. I think it's going to be an ongoing problem. In fact, you can see a lot of medical school admissions are decreasing over the country. It used to be fairly hard to get in. Now it's a little bit easier because a lot of there's some medical schools that have open positions after all of the applications. So it's been a problem, not just here locally but nationally, because of all that goes within in being a physician. Because I've been in this for 30-something years, completely different back then as to how physicians are trained and responsibilities now. So it's a interesting dynamic, but I do think the board, particularly with Advent getting a psychiatrist back on board, I think that'd be very helpful in trying to streamline some of the programs. I know some of the other agencies here in the district are working on trying to decrease stress levels, treating problems that come up with physicians, particularly with regards to substance abuse and how that plays into their practice in the district.
Right. I mean, I think I had a meeting yesterday with the head of DC Primary Care. She sort of described it as this sort of cyclical piece. You don't have enough providers, and then you don't have enough providers, you don't have enough appointments that you can offer. And then when you don't have enough appointments that you can offer, then you're not generating enough revenue, but also you have a number of people who are now using the emergency room as their primary care, but then you still don't have enough providers, right? So it's like a round and round bit of effect. You've been on the board since 2018. What do you want to do differently this time around in another term?
Probably one of the main areas that I think needs to be streamlined, and I've been advocating this for a while, is the resolution of, how can I say, problem physicians. When we see that there may be some problem with physician, how he practices, his outcomes, the system that we have to go through is fairly arduous to finally remove somebody from the practice of medicine in the district. In some cases, it can take years. And I think that's probably one of the main projects that I will look into in trying to help streamline that process of being able to have more effective disciplinary action on doctors who will deviate from the standard.
Dr. Dotson, just to clarify, when a complaint is brought against someone for the Board of Medicine, are they able to continue practicing while you all are doing your investigation? Or as this process is sort of playing out?
Yes.
Got it.
And that can be a real problem. And I'm not talking about just nickel and dime complaints. I'm talking about serious problems where we see that it's obvious that that there have been real problems. But a lot of times the board is handcuffed by the laws in the District of Columbia. Everybody has to have their due process and that can sometimes take, I've seen at least a couple of years in trying to get someone to stop practicing in the district. It's extremely difficult to speed up that process.
I definitely, I'm a fan of due process and wanting folks to make sure they have but when we're talking about serious, egregious allegations, and then you also are now having the opportunity to do that with more patients, that seems harmful. So we'll definitely take a look at that.
Sometimes you can do it in not direct approach, but if they're employed by uh, a business or hospital, whatever, the hospital can take disciplinary
They could take
action quicker
action.
than the Board of Medicine. They
That's-
are, if they are privileged at a hospital, those types of things. But if a person is just practicing strictly out of their office, I always joke with people, you can do brain surgery in an office if you have a willing patient, because nothing really regulates what happens in a doctor's office. And that's, you have a lot of people, like for instance, in my specialty, the plastic surgery, you have people doing plastic surgery in the offices, from internists, dentists, anybody. You can do whatever you want to in somebody's office. And
Yeah, we've seen the TikToks, and I think we had a nominee on dentistry who talked about the fake dentists who've been doing veneers that have completely
exactly.
damaging people's teeth. So I definitely understand. Okay, well, thank you, Dr. Dawson, for your willingness to serve. We're going to turn to Dr. Golich so she can provide her testimony. But
So
thank
can
you,
I go
Dr.
now?
Dawson.
All right, thank
You can go now. Yes, sir.
All right.
All right, thank you. Okay, when you're ready.
Okay, great. Good morning, Councilmember Henderson and members of the committee. I'm Dr. Laura Golojuk, and it's my pleasure to receive your consideration for my nomination to serve on the Board of Professional Counseling. I'm grateful to Mayor Muriel E. Bowser for nominating me, and honored to have this opportunity to serve the residents of the district. I am a licensed marriage and family therapist practicing in the district, and I also serve as a clinical supervisor for therapists in training. In addition to that, I'm currently a core faculty member at the Family Institute at Northwestern University in their online Master's in Marriage and Family Therapy program. I was born and raised in the DMV, and I also did my clinical training at the University of Maryland. As a DC resident for the past 15 years and a therapist for the past decade, I'm a passionate advocate for mental health and wellness for the residents of DC. Witnessing the events of the past several years has only strengthened my commitment to serving our residents and ensuring quality provision of care. Providing mental health care during a pandemic and during so much political upheaval in our nation's capital has been a challenge and a privilege, and I'd like to continue to serve our residents by joining this board. I am a marriage and family therapist, or MFT, who wears several different hats, and I consider myself to be a scholar, clinician, advocate. I served as the administrative coordinator for the Mid-Atlantic Division of our national professional organization, the American Association for Marriage and Family Therapy, and then later served on the board of the next iteration of this local organization. Through these roles, I interface with MFTs throughout DC, Maryland, and Virginia, often fielding questions about licensure, qualifications, and education. I became quite familiar with the regulations for the field and the requirements for each local board. I began as a clinical supervisor in 2018, first at the University of Maryland's training clinic, and then at the practice that I work out, counseling and consulting on the Hill. There, we saw a clear need for advocacy in our field. MFTs were not well recognized in the city, and there were very few pathways for recent graduates and students to become clear about what the process to becoming a therapist looked like in DC. I've always done my best to serve as a resource for therapists, and am a champion of training up the next generation of counselors and therapists. Through my supervising, I provide quality training for interns and resident therapists from both counseling and marriage and family therapy backgrounds. Through my faculty role, I ensure best practices and am part of a team that is passionate about training the next generation. This year, we are up for reaccreditation, which involves me becoming intimately familiar with the current standards and best practices of our field. All of my professional roles center around quality of provision of mental health care, while providing, whether this is providing direct clinical services to the public or training the next generation of therapists. With the merging of marriage and family therapy into the Board of Professional Counseling, I hope that I can provide more recognition of the value of the field of marriage and family therapy. Our training is systemic and relational, and we are uniquely qualified to provide couple and family therapy to the public. However, qualified marriage and family therapists have faced some challenges towards licensure and quality provision of care in the district. There has been no provisional or graduate licensure in Washington, D.C., as there is in most of the states in the U.S. Such licenses ensure regulation and supervision for newer therapists, both of which protect the public. Additionally, qualified and experienced MFTs have not been able to supervise counselors and therapists in other fields. Our supervisory process is a rigorous one, and the distinction of being an AMFT approved supervisor, which is the broadly accepted credential in our field, involves 30 hours of training, a 2-year period of supervisory mentorship, and extensive coursework and assignments. MFTs must be recognized as a legitimate counseling field, as they have so much to offer the public based on their clinical training and skill set. Finally, the mental health field has been working on provision of quality care in a new landscape of telehealth. This is an important growing aspect of our field, and with that, conversations around license portability are also essential at this time. I'm uniquely familiar with the challenges and opportunities of being a therapist in the DMV, and I want to ensure that highly qualified therapists are able to work with residents of the district. I'm very excited about the opportunity to serve on an interdisciplinary board of counselors and therapists. I believe that each of our fields has a lot to learn from each other, and that this will strengthen the provision of services to Washingtonians at large. Thank you for the opportunity to testify before the committee. I would be happy to respond to any questions.
Thank you so, oh, okay, I am on. All right. Thank you so much for your testimony and such a detailed look at your background in terms of professional counseling, but also serving as a supervisor, which I've learned a lot about through this role, not just for professional counseling, but social work and a bunch of other professions as well. Now, the Board of Marriage and Family Therapy was sunset earlier this year. It's moved into the Board of Professional Counseling, and you will fill that seat on the board. What do you think are some of the biggest opportunities for incorporating marriage and family therapy into the Board of Professional Counseling?
I'm really excited and hopeful about this. Our board was one that was smaller, and I think probably a lot of people didn't even maybe know it was there. The field of marriage and family therapy is a newer field. My license was the 239th in DC, and I know that social workers and also licensed professional counselors have way more people who are currently licensed. Because of that, I think it's really important to bring recognition to our field. By me being on a seat with the larger board of therapists and counselors and allied professions, we can all kind of collaborate and work together. Something that MFTs have faced barriers in, like I mentioned in my testimony, is that there's been no provisional license. So in most states, you complete your graduate training, you are under a period of supervision, and you receive a license saying that you're able to practice, that you've completed your graduate training, that you've passed an exam. And DC doesn't have that. And so it's been a very confusing process for people who are trying to get licensed in DC, and really has been a barrier to hiring and, recruiting MFTs who, again, provide really important services for couples and families.
No, I think that's super helpful. And I think your point about being the 239th is underscores what we were talking about here in terms of getting more capacity, if you will, by combining the two together. In terms of the role or in the work of therapy and counseling and behavioral health in general, one of the big challenges that we've had in the district is access, particularly for those who cannot pay out of pocket. A lot of licensed counselors or therapists, et cetera, who are, in business for themselves do not accept insurance or Medicaid for that matter. What role do you believe that the board could play in conversations with the Department of Healthcare Finance and others about how we can improve equity of access?
Yeah, that's a great question. Really important question right now. We certainly need funding for behavioral health, for mental health services. So I would encourage, funding going into agencies. But you do bring up a good point. I work in a private practice, and even the way that I was trained was that private practice therapists are out of pocket don't take insurance. In my practice, we've been one of the practices that has said, this is important in terms of access and equity to accept insurance. But right now, the landscape of managed care and insurance is also extremely frustrating for therapists. So therapists in DC in particular, because we have a pretty saturated market, are being paid way, way under market rate by insurance providers. So I don't know what powers, the district might have, but we are not getting rate increases from insurance providers. And, it's really not financially worth it for private practices to be taking insurance. But again, there are some of us who really believe that this is an important way of promoting equity. And so are willing to take some of those pay cuts. So therapists are having to really make hard decisions right now. And this is a big conversation within the community.
Yeah, provider payment is like the biggest thing. It's also very expensive. But that being said, for the number of providers who tell me that they don't take insurance, then I look at our Medicaid payments that we make under behavioral health, and I'm like, well, then who are we paying? I think in the last year, we spent $38 million on telehealth, audio only, behavioral health services, which I think is kind of crazy. $38 million worth of just audio only. But then if I have all of the majority of my providers who are licensed in the district saying that they're not actually taking insurance, then I'm like, who are these people who are getting paid? But that's a story for another day. One of the questions I asked the other folks, and Dr. Dawson, who was on the panel with you, he's been on the board, so this was kind of he knows what it's kind of about. So for you though, Dr. Golachuk, being new, have you had a conversation with someone at DC Health or the board around the time commitment, and do you feel like you have the capacity to do this work?
I do, yes.
Okay, great. All right, well, I don't have any other questions for you. I thank you so much for your testimony and for the documents that you all submitted. The Mayor's Office of Talent and Appointments have also submitted on your behalf. So thank you so much. Overall, I want to thank all of the nominees for agreeing to serve in the district. For those watching at home, I feel like it's like a bi-weekly PSA that I make these days, but volunteering on a board or commission is an excellent way to give back to the district and to inform program and policy decisions. And so if you're interested, go to the MOTA website and see what is open and available that aligns with both your credentials, qualifications, and interests. This concludes today's roundtable. The Health Committee will hold its next meeting on Monday, November 18th. We will vote on these nominees as well as two permanent bills, Bill 25-692, the Enhancing Mental Health Crisis Support in Hospital Amendment Act of 2024, and Bill 25-696, the Reproductive Options for Everyone, also known as ROE Amendment Act of 2024. The time is 10:36 a.m. and this roundtable is adjourned. Thank you all.